Our pediatric project is on pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. It is common for children under 5 years old to get a lung infection like pneumonia. For most children, symptoms usually last 2 to 4 weeks. Anything past that, they should consult with a doctor. Pneumonia is a complex infection and is seen in 4 different stages. During the first stage, which is known as the congestion phase, the lungs become very heavy and congested due to infectious fluid that accumulates in the air sacs. And then stage 2 usually occurs after 48 to 72 hours and lasts for 2 to 4 days. It's when the affected lung becomes more dry, granular, and airless, and it resembles the consistency of a liver. Usually during this time, red cells, white cells, bacteria, and cellular debris can clog the lung airways. And then in the third stage, also called the gray hepatization stage, this usually occurs day 4 to day 6 and continues for 4 to 8 days. The lungs begin to look gray or more of a yellowish color, usually the same consistency of a liver. And then the next stage, stage 4 resolution, is the final recovery stage and occurs during 8 to 10 days. This is when fluids and breakdown products from cell destruction are reabsorbed. Macrophages are present and they help clear white blood cells and leftover debris. However, if recovery is unsuccessful, the patient may begin to feel more severely out of breath. Also, they may feel reduced lung function, making breathing labored, or having frequent flare-ups. They also might find it more difficult to maintain a healthy body weight due to lost appetite and become more anxious or depressed.
The most common cause of pneumonia in newborns is group B streptococci. For infants between the ages of 3 weeks and 3 months, the most common cause is chlamydia. Other causes are RSV, rhinovirus, adenovirus, and pneumococcus. Pneumocystis jirovecii is common cause of pneumonia for immunocompromised children. Aspirating, this could be on like food, or maybe they accidentally put a small object in their mouth. Inhaling oil-based substances, or even poor circulation. And this could be from not turning and staying in one position for long periods of time.
Some signs or symptoms are coughing, breathing that's quick and laborious, the skin between and around the ribs, and breastbone is drawn in. The nostrils flare out, meaning they widen. Chest pain, especially while coughing or breathing deeply. Wheezing and reduced oxygen in circulation causes a bluish tinge to the lips or nails.
When diagnosing pneumonia in children, the health provider can usually diagnose based on the time of year and the child's symptoms by watching the child's breathing and by listening to the lungs. To check for or to rule out if it's bacterial pneumonia or viral, there's usually a chest x-ray ordered with blood and other tests, such as like PFT or spirometry.
Some treatments or medicine for pneumonia can be given is antipyretics, and this could be for fever. If the child is having a problem breathing, or you see that they're starting to turn blue, you can give them oxygen, increase in fluids. For infants that are younger than 6 months, pediazole could be administered, and for children up to 5 years, amoxicillin. Cough suppressants, rest. The pneumococcal conjugate vaccine is recommended for children younger than 2, and the valent pneumococcal vaccine is for children older than 2 if they are immunocompromised.
I recall the day my newborn cousin became ill. It was winter, and my family and I were planning a vacation to Lake Tahoe to visit our cousin's family. He might caught a cold because it was snowing heavily. He began coughing the next day, and his lungs began feeling pain. Our family assumed it was a common cold or the flu, but it was so awful that we had to see a doctor since he was complaining about his lungs aching so much. Following a visit to the doctor, we received the test results. He informed our family that he had emphysema, a consequence of bacterial pneumonia in which pus from the infection accumulates in the pleural area to the lungs. He told our family that he will assist him, but that he would require immediate surgery to remove the bacteria from his lungs. One terrifying aspect was that it was close to the heart, and they wouldn't know if there's any damage until they went inside. Surgery was successful, but he lost 15 pounds, and recovery took at least a month.
These are some statistics that I found about pneumonia in children. According to UNICEF, a child dies every 39 seconds from pneumonia. Pneumonia kills more children than any other infectious diseases, claiming the lives of over 800,000 children under 5 every year. Progress in reducing pneumonia deaths in children under 5 has been significantly slower than for other infectious diseases. Around half of childhood pneumonia deaths are associated with air pollution. The effects of indoor air pollution kill more children globally than outdoor air pollution does. Some preventions and nursing interventions regarding pneumonia in children. Immunization against HIV, pneumococcus, measles, and whooping cough is the most effective way to prevent pneumonia. Adequate nutrition is key to improving children's natural defenses. And some nursing interventions for pneumonia in children are oxygen therapy, suctioning, mechanical ventilation, deep breathing, and adequate hydration.